Is that normal?
No, isn't it supposed to be like 20 to...
Yeah, it should be 20 degrees.
I thought that was pretty good. Really? I think that's pretty good.
Oh.
No, I'd say it's 20. It's 50 for planner, actually, right?
Yeah, because you're only looking for about 20 degrees, right? So if this is 0,
That's 20.
that's normal.
Just where I was sitting.
That's why it says for these guys. And it's about
Yeah.
the same. Okay. What area did I stress or look at for his dorsiflexion?
The gastrocs.
Gastroc, 2-joint muscle. So the knee is straight, ankle needs to go into dorsiflexion, that's what we check. So if that's normal, am I worried about muscle? No. And I do care, you know, can he do it himself, all that stuff. That's not the point, I'm just trying to talk about walking. I'm not trying to talk about stage of the exam. So then we take away muscle. So now what are we looking at? Capsule, not posterior. Looking at anterior capsule. And the other thing too is positional fault. What bone am I worried about here? Talus. What direction does it go and get stuck and cause us with dorsiflexion limitations? Anterior. So in here, muscle's out of the way. So I'm looking to see if he gets his appropriate amount of motion. So that's another thing. Make sure everything's in line, get your motion. The other thing that leads you in the right direction during range of motion testing is if they have a problem with dorsiflexion with walking, they'll complain of stiffness. If that stiffness is back here, what's the first light bulb? Gastroc. If they have stiffness and they're complaining of stiffness in the front of their ankle, like it's stuck, there's talus, positional fault, or capsular restriction. Okay, so he can't get past this, it's stuck. I push this back, it's stuck. What's the possible thing I'm worried about? You got one shot. Capsule, okay. He's stuck. I push this back. It's all the way better. What am I worried about?
Yeah. What is making it stuck?
The positional fault, so the talus. You push the talus back where it should be, gets better. That was another question on those sheets. How do we determine capsule versus positional fault? Prognosis-wise, you guys said capsule takes a while to get better, so you can expect minute changes at first, but certainly with pain. But if his range drastically gets better, positional fault. So why are we doing this? Because initial contact, we have to worry about dorsiflexion. Those are some of the things that could limit dorsiflexion. The next, weak plantar flexors. So you may see someone walking like this. They can't push off, so they need to step and dorsiflex rather than push off with their feet. Functional flat foot, that's where we go into non-weight bearing and then weight bearing. Jump up onto your feet. You could stay on the table.
That's what you just talked about.
Yep. So we have to find subtalar neutral, which we'll do in a second. But all you're going to do is find the talus in the front of the ankle. Just watch out for the tendons. You have to go in between them. So sinus tarsi, which is on the lateral, anterolateral spot. Here, turn around so they can see. Sinus tarsi is the region on the anterolateral spot right there. It's squishy, right? So that's where we get one spot. Then if he lift up your toes, you'll see that the anterior tib gets in the way, so relax. We get onto the side of that, so woo! So we get to that to be on the other part of the talus. So we want the talus to be when he rocks his foot back and forth. So pronate and supinate for me. You should be able to feel that talus move under your fingers. Forward, away, and you want it to be in the middle where it is the most away from your fingers. So relax, 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 relax. No, it's like relax your foot. That's not relaxing, that's supinating. Just relax, stand still, don't do nothing. Good. So roll your foot out a little bit. Good, roll your foot in a little bit. Roll your foot out a little bit. Roll your foot in, do it slower. Good, stop right there. Okay, so that's where his talus gets most away from my fingers. So I felt it roll into one finger, into the other finger, into the other, and you do it slowly so you know where you're going. So then this is his subtalar neutral. You could do this in weight bearing, you could do this in non-weight bearing. This is how you do it just in weight bearing. So then you want to look at his relaxed position. So if this is where he should be, then when he relaxes, he should stay there. Whereas if, let's say he has flat feet, if you relax, it'll cave in. For him, it's not that bad. Maybe it moved a little bit, but nothing like that. So you're gonna notice whoever has flat feet in the room, make sure that you are the person on the table, so we can go around and show the partners what it looks like.
Why are you checking because that's the joint it's coming from, and why wouldn't you check the navicular placement? Like for, you know what I mean? Like for functional versus non-functional?
You can do the navicular as well.
Okay.
That's coming up. That's the one where we talked about there should be a straight line from metatarsal head to
Right, and
navicular.
then once they put weight.
And then,
it
yes.
changes.
But what normal is subtalar neutral. Talus is gonna, or navicular are gonna go with the rest of the foot. So subtalar neutral is there. You're looking at the navicular, you can see that's navicular drop test versus this. You're just looking at subtalar neutral, non-weight bearing versus weight bearing. This is in weight bearing. So that's something that you have to be concerned about too when it comes to movement side to side during walking, which is needed when we load. Good, lay on your stomach.